ओम धम धन्वंतरे नमः। रागादि रोगान सतान शक्तान अशेषकायान प्रस्थाशेषान औत्सुक्य मोहान प्रतिदान जघाना यो पूर्व वैद्याय नमोस्तु तस्मै। Let me share. Today's topic is Ayurveda management of cervical spondylosis. Cervical spondylosis means a degeneration jaundice of the cervical spine. That is osteoarthritis of the cervical spine, cervical vertebrae. So the symptoms will be pain and stiffness in the neck region and pain in the upper extremities, and there will be weakness. The muscle wasting will be there in chronic course. So X-ray finding, if you take the plain X-ray of the neck, lateral view or anteroposterior view, there will be features like decrease in joint space, decrease in intervertebral joint space, and subchondral cirrhosis or cyst formation, and osteophytosis. There is a good treatment in Ayurveda for cervical spondylosis. There will be bone pathology. Also, there will be nerve rotations sometimes pressure, means the nerve compression will be there, leading to degeneration of the nerves. So we can give Snehana, Svedana, Snehana in the form of Abhyanga, Sneha Abhyanga, Nasya, Snehana Nasya, and also Basti, Snehapana and Basti, Matra Basti is very useful. And Svedana, like Nadi Sveda, Satrapinda Sveda, these are helpful. And Griva Basti, these are helpful. And internally, we use Rasayanas, Vedana Stapak Aushadhis, analgesics, and hematinics, and Nadi Valya Aushadhis, etc. These medicines are given. Vadahara drugs, these are given. Snehan and Svedana is given. The use of Patyapatya, diet therapy, they are also helpful in the management of cervical spondylosis. Musculoskeletal and neurological disorders are on the rise in the world population. Osteoarthritis of the cervical spine is the cause of cervical spondylosis. In this disease, X-ray finding like increased intravertebral disc space, subchondral sclerosis, loss of curvature of the neck are usually seen, and osteophytosis are also usually seen. There will be degeneration of the cervical nerves because of the root compression. Symptoms like pain and stiffness of the neck region, restriction and muscle wasting and strain in the upper limbs. Internal use of Ayurveda Vyadhi Pratyanika drugs, Vedana Stapaka drugs, Rasayana, Nadivalya, that is Narvan tonic, Poshaka, that is nutritive, Jivaniya, vitalizers, Ojaskara, immunity boosters, and Vatahara drugs are effective. And also, Panchakarma therapy, the Pirivavasti, Matravasti, and Abhyanga, Sthanika Abhyanga and Nadi Sveda are also useful. Patyapatya Prayoga, Diet therapy are usually practiced in the management of cervical spondylosis. Some cases of cervical spondylosis are completely relieved by Ayurveda treatment. This is the MRI of the neck region. You can see the pelvis. This is a plain X-ray of the lateral view of the neck, the vertebrae. You can see the features of cervical spondylosis. The intervertebral disc space is narrowed, the subchondral sclerosis is seen, and presence of osteophytes and the loss of curvature of the neck is evident by X-ray. This is another X-ray. You can see neck is the curvature is lost. The intervertebral disc, the intervertebral space, joint space is narrowed. There is subchondral sclerosis and osteophytes are seen. This is another X-ray where you can see changes, degenerative changes in the cervical vertebrae. You can see the intervertebral space is narrowed, subchondral sclerosis seen, and loss of curvature, and osteophytosis. If you analyze the drugs and formulations are usually given in cervical spondylosis, these will be having the following actions: Vedanastapaka, analgesic, Rasayana, Brahmana, Snehana, Vedana, Poshaka, nutritive, calcium supplementation, Astivardhaka, Ojaskara, Jivaniya, and Vata. Now let us see which are the Panchakarma procedures that are commonly practiced in cervical spondylosis. Abhyanga, Vedana, Matravasti, Kashayavasti, Divavasti, Nasya, and Anvasarvasti. Abhyanga, you can give Mahanarayana Taila Abhyanga or Mahavishagarbha Taila Abhyanga or Vishagarbha Taila Abhyanga. Vedana, you can give Nadi Sveda or also you can give Patrapinda Sveda also. So you have to avoid the vital parts, the neck. The anterior part you can see the blood vessels are there, they are going to the brain. There you should not give Vedana. Matravasti, you can give Dhanantar Taila Matravasti or Shirabala Taila Matravasti. Okay. Or Narayan Taila Mahatravasti can be given. Kashayavasti, you can give Dashamula Kashayavasti also given. Grivavasti, we can use Narayana Taila or Shirabala Taila. Nasya, we can give Mahanarayana Taila, Shadbin Taila or Shirabala Taila. And in Anvasanabasti, you can use some Snehas. Now see, let us one by one the actions and the drugs. Vedanastapaka drugs are Uggul Kalpas, various Uggul Kalpas. Trayodashana Uggulu, Yogaraja Uggulu, Keshara Uggulu, Mahayogaraja Uggulu, Amritadi Uggulu, Chadanga Uggulu, and also Shallaki tablets, Balarishta, Maharasnadi Kashaya. This is Nasya therapy. You can give Nasya of Kerala Taila or Dhanantar Taila or Mahanarayana Taila or Shadpint Taila. This is the Basti, Mantra Basti can be given very effective, or Kashaya Basti also very effective in cervical spondylosis. Mantra Basti can be given by using Dhanantar Taila, Kirabala Taila. Griva Basti therapy we can give in cervical spondylosis. These are a very good result. The drugs, Guggulu, gum Guggulu is processed with the Trifala Kashaya and the Shodita, then it can be used in the preparation of various Guggulu kalpas. This is the plant Comifera mukul. This is in desert lands, it is usually available, cultivated. The Shallaki resin. So it is a shell resin of the plant Boswellia serrata. So this is a plant Boswellia serrata. This is a Bala, Sida cardifolia. Bala rista can be used. Bala taila for application also you can use in case of cervical spondylosis. It belongs to the Malvaceae. is the Nirgundi, Vitex negundo. The plants, the leaves, powder is internally Nirgundi Taila prepared by using Panchanga of Nirgundi or with leaves of Nirgundi is very effective in Abhyanga in this case. Now let us see analgesic drugs. Ayurvedic analgesic. Challaki tablets, Nirgundi Patrachurna, Yogaraja Guru, Rasnadi Guru, and Daksha. Rasayana drugs, Ashwagandharista, Balarista, Tirabala Mahayogaraja Guru, Ashwagandhava Deha. And Brahmana drugs, so Vata increases on Karsha, Dhatu Chaya. We had, in some cases, we had to give Brahmana drugs. Like Ajamam Sarasayana, if he is a non-vegetarian, we can give Mamsa Rasayan, Ajamam Sarasayana. If he is vegetarian, Masha Nirmita, Ahara Kalpana, Kushmandavaleha, and Ashwagandhavaleha, and Kukutanda. Snehana, Abhyanga you can give by Mahanarana Taila, Panchagana Taila, or Mahamasha Taila. Also, Prabhanjana Vardhana Taila and Kirabala Taila. Kirabala Taila can be given internally, 1 not 1 hour tea or 11 hour tea is useful in cervical spondylosis. Nutritive. Vedana. Stamba Gaurava Shitagnam, Vedanam Svetakarakam. It relieves Stamba and Gaurava, not Vedana. So, Priva Sveda, Nadi Sveda, Patapinda Sveda, and Valka Sveda can be given. The Poshaka drugs, Ajam Sarasayana, Amsarasa, Ukutanda, Dex, Mashanirmita Harakalpana, Kushmandavaleha, these are very useful. The nutritive substance, drugs or substances, food, Godugda, Gogruta, and Shirabala Taila. Calcium supplements. So there may be osteomalacia. Okay. So calcium concentration may be reduced, calcium content in the body may be reduced. So you can give Pravala Pishti, natural calcium, Pravala Pishti, Pravala Vasma, Mukta Pishti, Mukta Vasma, Pravala Panchamritarasa, Mukta Panchamritarasa, and Vasma. You can also give Vadatika Vasma. So Astivardhaka drugs like Anjod Vasma, that's the preparation. Kurandatak Vasma, Mudan Vasma, and Mridashan Vasma. Ojaskara drugs, Ashtavarga Kashaya, Ashtavarga, it is Vriddhi, Vriddhi, Jivaka, Shabaka, Kakoli, Kirakakoli, Meda, and Mahameda. Now all the drugs are not available. We can use substitutes like Katavari, Vidarikanda, Varahikanda, and Ashwagandha in double quantity can be used to prepare Ashtavarga Kashaya. Vidarikanda Churna, other drugs, Vidarikanda Churna, Godukta, and Gogruta. Ojaskara drugs. So, Ashtavarga Kashaya, Vidarikanda Churna, Godukta, and Gogruta. Divanya drugs, vitalizers. Godukta, Dugdhavarga, Ashtashiravarga, Ashwagandhavalaya, and Ashwagandha Arista. Lastly, Vatahara drugs. There is, due to Dhatu Chaya, there will be degeneration. We had, because of Vata, we have to give Vatahara drugs like Taila Bhyanga, Matra Vasti, Uggur Kalpas, Tila Taila, and Anuvasana Bastya, Sneha Vasti. Patyas in cervical spondylosis. Vatahara Ahara Vihara, Snigdha Ushna Poshaka Ahara, Tila Taila, Mamsarasa, and Brahmana Ahara. Apatyas, Vatakara Ahara Vihara, like Lagu Rucha, Shita Ahara, Pradana Ahara, Kanda Ahara. Some tubers, they are also Vatavardhika. Ati Vyayama, excessive walking and reading, they are also because Vata. Coming into discussion. Cervical spondylosis is a degenerative joint disorder occurring in the cervical vertebrae. X-ray study reveals intervertebral joint space narrowing, subchondral stenosis or cyst formation, and osteophytosis. Clinical features include pain in the neck region, stiffness, pain referring to fingers of the hand, muscle wasting, the upper limbs. Ayurveda treatment has important role in cervical spondylosis. Nidana Parivardhana, use of Vyadhi Pratyanika, Aushadhis, Panchakarma therapy involving Pratyapatya and diet therapy are useful in the management of cervical spondylosis. By Ayurveda treatment, signs and symptoms of the disease can be alleviated. Ayurveda treatment is cost effective, safe, and affordable in this disease management. So we can give 3 months treatment, not completely cure. We can continue to six months also. And most of the cases we are getting good results. Coming to conclusion, Ayurveda treatment in cervical spondylosis is cost effective, safe, and affordable also. The intensity of symptoms can be relieved or can be reduced by the application of Ayurveda treatment. Also, today we have discussed the role of Ayurveda management in cervical spondylosis. Thank you.